fornix, that sort of area of reflection between that part of the conjunctiva covering the eyelid down here, the palpebral part, and the bulbar part. You can also see a little bump right here with a hole, and that's the inferior lacrimal punctum. Okay, and then there's also a superior one here in the sort of medial aspect of the eye. Okay, like I said, the lacrimal gland located superolaterally in the orbit, and that's going to be producing tears. Okay, which will drain from a lateral to medial aspect across the surface of the eyeball, and those tears will drain into these little tubes, these lacrimal canaliculi. There's sort of a couple of them, a superior and inferior one, that drain into this larger structure, this lacrimal sac. And then from there, the tears drain down this nasolacrimal duct, which opens into that space in the nasal cavity called the inferior nasal meatus. So that's why you get sniffles when you're crying, or why you have a runny nose, is because the tears themselves are draining into the nasal cavity. Okay, so moving on, we'll talk about the arteries and veins of the orbit. So the main blood supply to the orbit, of course, is the ophthalmic artery, and many of you saw this on Monday, this little artery that comes off of the internal carotid artery. So as the internal carotid artery gets into the basicranium, or the middle cranial fossa, really, what you see is the ophthalmic artery is given off and goes underneath the optic nerve. So you may have to lift up the optic nerve to visualize this artery, okay? But you should see it traveling in the optic canal with the optic nerve. These are the only two things that arrive into the orbit via the optic canal. The rest travel through the superior orbital fissure. Okay, so this artery will come in with the optic nerve, and then it will cross anterior to it in the orbit. So that's why they're in close relationship in the orbit. You'll always find the ophthalmic artery crossing sort of from lateral to medial, anterior, just anterior to the optic nerve. And then that's going to give off a bunch of little twigs here. You see the ones that you'll probably want to actually look for in dissection would be the lacrimal artery, which is pretty obvious to the lacrimal gland, laterally. And then, of course, you'll see these supraorbital and supratrochlear arteries going to their respective areas. And remember, these are going anteriorly towards the scalp. Medially, you'll see some of these ethmoidal branches, these anterior and posterior ethmoidal arteries. And those are going to be following with some nerves that have the same name. Okay. And you may see some of these posterior ciliary arteries going to the sort of posterior aspect of the eyeball as well. You won't see the central artery of the retina unless you bisect the optic nerve, which I probably wouldn't recommend. Veins, so the veins of the orbit, you can see some of, those veins of the face that communicate with veins in the orbit are here. The supraorbital, supratrochlear, and the angular vein. And these can communicate with either one or two of these veins here, what's called the superior ophthalmic or the inferior ophthalmic vein. And so this is, again, something Dr. Flegel mentioned on Monday, how infectious material can pass from the face through one of these tributaries, or one of these down here, facial vein, infraorbital vein, and then communicate with the inferior ophthalmic or the superior ophthalmic vein to reach the cavernous sinus, where infectious material can be much more serious. Okay. And also another route is through this pterygoid venous plexus. So some of this blood will go down through that pterygoid plexus and not reach the cavernous sinus. What you'll see the superior ophthalmic vein in dissection superficial to the artery. Okay, so the first sort of blood vessel you'll see will likely be the superior ophthalmic vein because it has sort of a similar orientation to the artery, but the artery is deeper, much closer to the optic nerve. Okay. So the nerves of the orbit. I'm going to talk about everyone's favorite cranial nerve, the trigeminal nerve, just the V1 branch. And then I'm going to talk about these much smaller cranial nerves, 3, 4, and 6. Although I'm really not going to focus on the parasympathetic part of the oculomotor today. We'll do that in a later lecture. So here they are. So the oculomotor nerve is primarily a somatic motor nerve to a lot of the muscles that move the eyeball. Has parasympathetics as well. The trochlear nerve goes to just one of these movers of the eyeball called the superior oblique muscle. And likewise, in a similar fashion, the abducens nerve, cranial nerve 6, also goes to just one extraocular muscle, that's the lateral rectus. So those are very easy cranial nerves to understand. They only do one thing. Fortunately, this one is a little more complicated, as it does a lot of sensory to sort of that region of the face above the eyebrows and part of the eyeball. And I'm sure everyone has this memorized already from my last lecture, maybe not. And someone in lab on Monday, who will remain nameless, mentioned to me that on this slide, the short ciliary nerves look longer than the long ciliary nerves, and that was confusing. And I will emphasize that this part right here is what's actually called the parasympathetic root of the ciliary ganglion, and the short ciliary nerve is just this dotted line emerging from the ciliary ganglion. And you can see that in this more schematized picture here, that these short ciliary nerves, these tiny little nerves, and the long ciliary nerves come off of this other nerve called the nasociliary. So you'll see when you remove the floor of the anterior cranial fossa, you'll see something like this, a bunch of nerves in the orbit, and how you'll want to orient yourself is you'll want to find the frontal nerve, this one right in the middle. So that'll be basically the first structure you'll see in lab after you clear out some fat. The frontal nerve is very large, it's very obvious, and it's right in the midline. So look for that one, and then from there you can find the lacrimal nerve laterally and the nasociliary nerve medially, okay? And then there are subsequent branches afterwards. So the ones that will be very obvious in lab will be, again, the frontal nerve and its two branches, the supraorbital and the supratrochlear nerve. The supratrochlear will be medial to it. This will not be super obvious. The nasociliary nerve will be obvious. It'll be, again, medial to the frontal nerve, and you'll see a bunch of twigs off of that. You should find the long ciliary nerves, some of these ethmoidal nerves, and the lacrimal nerve as well. You should find. You won't see this communicating branch. Okay, so here's what it actually looks like in the lab. You can see V1 going through the superior orbital fissure here, and then you'll see that will continue as soon as it gets into the orbit. It will change its name to the frontal nerve, and you'll see it divide into the supratrochlear and supraorbital nerve. Usually, in my experience, does not divide quite this early. It might divide further up here, but nevertheless, you should see that. Laterally, like I said, you'll find the lacrimal nerve going into the lacrimal gland. And there are parasympathetics running. Does anybody remember where I said the parasympathetics that control the lacrimal gland, where they're from? Or what ganglion or what cranial nerve are they from? Exam practice. No? Not ciliary. That would be the intuitive one. Yeah, from the pterygopalatine ganglion, right? So ultimately from facial nerve. Okay, so that's the one you'll see laterally. Again, medially and a little bit deep, so you'll have to go a little bit deeper in your dissection here. See, they've reflected some muscles already, but you'll be able to find the nasociliary nerve, which is sort of easy to identify because of a bunch of branches it gives off medially. So if you find a nerve that has a bunch of these twigs heading medially, you'll know you'll found the nasociliary. So first you'll see a posterior ethmoidal nerve and an anterior ethmoidal nerve going to innervate, provide sensory innervation to these ethmoidal air cells, which you'll see when you break off this part of the bone here. And then that will continue anteriorly as the infratrochlear nerve, so named for the trochlea or pulley of the superior oblique muscle, which is this point thing right there. Also from the nasociliary nerve, you'll see some branches going laterally. Okay, you'll see that root of the ciliary ganglion. You may see the ciliary ganglion itself, although it's very small. Not everyone will find it. But if you do find it, it'll be easy to see the little short ciliary nerves running just from the ganglion carrying parasympathetics, the long ciliary nerves from the nasociliary nerve itself, not communicating with the ganglion. That's how you tell those two apart. Okay, and here's just another picture of the same thing. So you can see V1 going into the orbit here, changing its name to the frontal nerve, the nasociliary nerve, the lacrimal nerve, being the three main branches you'll see today from V1. Okay, and there's some other nerves in here that we'll talk about right now. The other major nerve in the orbit is the oculomotor nerve. The oculomotor nerve, you saw it in the cranium, sort of hanging off, going through the superior orbital fissure. You may have seen it on the brain too, sort of just superior to the pons. Anyway, so this nerve will come in and supply somatic motor innervation to 5 of the muscles in the orbit, which I'll talk about more in a bit. And what you can see is that it sort of separates as it comes in. It's the orange one here, the oculomotor nerve, in this figure. So there's what's called a superior division and an inferior division of the oculomotor nerve. So when you reflect the levator palpebrae superioris and the superior rectus, these muscles here, you're going to have to reflect them to see the other structures. As you do that, you'll also reflect branches, pieces of the superior division of the oculomotor nerve. So look for that nerve on the deep surface of these reflected muscles in lab. The inferior division will head, as the name implies, inferiorly, and will communicate with the ciliary ganglion, and that's the part that will be relaying parasympathetics to that ganglion to innervate some intrinsic eye musculature. Next is a very simple nerve, the trochlear nerve. So the trochlear nerve also reaches the orbit via the superior orbital fissure, like most things, and it'll come in. Many of you probably didn't see this on Monday. It's very easily torn. And it is a very small nerve, okay? It's a very tiny nerve, but you should see it in the middle cranial fossa next to the stalk of the trigeminal nerve, which is, of course, huge. So you may see a little twig through there. It'll then enter the orbit and pierce the superior oblique muscle from a superior aspect. So it'll come from above and pierce that muscle belly right there. Okay, and that is also a good way of sort of identifying this nerve and this muscle together. So that muscle, superior oblique, is like the medial most muscle you see in the orbit. So it's pretty superficial from this aspect and very medial. So you'll see that and its associated nerve. Okay, there it is. And so here it is in this cartoon. It's just this purple one coming in and piercing the superior oblique from a superior aspect. The last important nerve in the orbit that you should look for is the abducens nerve, and it can be pretty difficult to find. The abducent nerve in the middle cranial fossa was sort of hanging off the clivus. You may have seen it there. You should have seen it there. Also goes through the superior orbital fissure along with a lot of these other cranial nerves. And then heads to the medial aspect of the lateral rectus muscle. Okay, so it's on the sort of inside of the lateral rectus muscle. So you're going to have to go to the lateral part of the orbit and peel back this muscle and look for a nerve going into its medial side. And then you'll know you'll have found this nerve right here, the abducent nerve, this green one right here, innervating just the lateral rectus. So now we've discussed the nerves in the region. We're going to talk about the musculature, the extraocular muscles of the eye, their attachments, and what they do. So there's 6 muscles, okay, that move the eye around, and 1 muscle that elevates the eyelid. And then there's 3 intraocular muscles that change the conformation of the lens and the aperture of the pupil, essentially. So here we see the configuration of the movers of the eyeball, or the muscles that move the eyeball. And you can see that they're sort of set up sort of this cross orientation for these rectus muscles, and sort of these oblique orientations for the named obliques. The rectus muscles are just named for their position, so superior, medial, lateral, and inferior. And again, the obliques, just named for their position. And you can see the obliques the superior oblique goes through that pulley, that trochlea, and then swings around. It has a long tendon that goes to the superior aspect of the eyeball. Inferior oblique also has this sort of long attachment to the sort of inferior aspect of the eyeball, and is actually not really visible from the superior approach. So when you dissect from the superior